Hello, and thank you for joining us for Community Crossroads. I'm Carolina Astrain. Here's a look at what's coming up on today's show. We learn about speech therapy, a special kind of speech therapy. We also hear from Theater Victoria, the Victoria Police Department, and the Cuero Chamber of Commerce. First, we hear from a speech pathologist from PAM Rehabilitation Hospital of Victoria. Welcome, Sarah.
Good morning.
So, Sarah, June was National Dysphagia Month. Can you talk to us a little bit about what dysphagia is?
Well, dysphagia is a swallowing disorder. It's difficulty swallowing anything from your own saliva to food and liquids.
And so how does this come upon a person? Is it something you're born with, or?
No, it's usually the result of another, something else that's going on in your body. It could be from neurological disorders like a stroke, Parkinson's disease, dementia. It could be from head and neck cancer, the treatment from head and neck cancer. There's a variety of reasons that dysphagia could occur.
And it's something that can occur to infants, children, adults?
It can affect all populations.
When it comes to children, I think of perhaps getting through meningitis. I know my little brother had that when he was first born. Is that the kind of disease or situation that would result in dysphagia?
No, it's more having to do with structural problems, muscular problems, things like that.
I see. So if an infant suffered a trauma related to the
throat.
throat.
Definitely, definitely.
And what are some signs, and how quickly can you go from detecting those signs to how quickly do you need to jump into action?
Well, some of the signs and symptoms could be anything from difficulty chewing, holding food in your mouth, difficulty swallowing, coughing, throat clearing after the swallow, and then just feeling like food is stuck in your throat.
Wow, what an uncomfortable feeling.
Yes, yes, and scary too.
What are some bits of advice that you'd give to people who notice these symptoms among themselves or potentially a family member?
Go to your doctor. The first thing you want to do is go discuss it with your doctor, and then you want to have an instrumental exam done. At PAM, we provide what's called a FEES, a flexible endoscopic evaluation of swallowing. There is a scope that is inserted transnasally. That way we give you things to eat and drink. That way we can see what is happening and what exactly the dysfunction is to better know how to treat it.
And what are some exercises that y'all do with patients to improve the
Well, we have therapeutic exercises, and the best exercise for swallowing is actually to swallow. We also provide neuromuscular electrical stimulation to assist in the swallow and strengthening those muscles. And we have the McNeil Dysphagia Therapy Program that focuses on the function of the swallow and the muscular strengthening to promote safe swallow.
And what's the average amount of treatment time that it takes to get back to normal?
That all depends. It really depends on how severe the dysfunction is. There's anything from mild to severe dysphagia, so it's on a spectrum, and it all depends on what structures have been damaged or aren't functioning properly.
So this is a muscular disorder. It's not an inflammatory disease.
Exactly.
Like you would typically get that's, blocking you from swallowing, or
exactly.
It's a muscular disorder.
Yes.
Wow. And what else should our viewers know about dysphagia?
It is treatable. You should find out, go to your doctor, get the instrumental exam, and then go to a speech therapist, go to a speech pathologist. They have a wealth of knowledge in how to treat and help get you back to swallowing safely.
A very vital function of the body.
Yes, ma'am. Yes, ma'am.
Well, thank you so much, Sarah, for joining us and sharing this information.
My pleasure.
All right, well, coming up, don't go anywhere. We hear from Miss Curve, Texas.